Good afternoon. My name is Allison Barkoff, and I'm the Acting Administrator and Assistant Secretary for Aging at the Administration for Community Living. I'd like to call to order this 9th meeting of the Family Caregiving Advisory Council. I want to start by thanking everyone for coming today and helping us mark an important moment for caregiving. Today, we're taking the first major step in implementing the Raise Family Caregiver Act, the completion of the Council's initial report to Congress. This report identifies the major issues facing caregivers and provides a set of initial recommendations. This report will be formally submitted to Congress tomorrow. I want to start by thanking the Council members for their hard work and commitment. Completing this report anytime would be a huge feat, but completing it during this pandemic, when so many of us were taking on even more responsibilities as family caregivers, makes this even more remarkable. This report comes at a time when the issue of supporting caregivers is front and center. The last 18 months of the COVID pandemic has shown a spotlight on the importance of family caregiving and how family caregivers too often have to step in to fill the gaps in our long-term care system, gaps that have been exacerbated throughout the pandemic. At the same time, COVID-19 has laid bare the risks of living in institutional and congregate settings, making the work to support family caregivers and filling the gaps in formal care that help people remain in their own homes and communities and out of institutional and congregate settings even more urgent. That's why caregiving is a centerpiece of President Biden's Build Back Better plan and an issue that Congress is focused on literally as we speak. The fragility of our caregiving system has finally become visible to the public eye with nearly daily stories in the media. There are 53 million family caregivers in America, and at any given time, 1 in 7 of us serves as a caregiver. Today's report describes who those caregivers are, including oftentimes children and teen caregivers. Throughout the work of the Family Caregiving Advisory Council, we are giving voice to family caregivers and addressing the Biden-Harris administration priority of strengthening the caregiving infrastructure. The report underscores the needs caregivers have for training, for support, and for opportunities for rest and self-care. It details the lost income, increased stress, and greater social isolation that many family caregivers face. The report also shines a light on the many positive aspects of family caregiving, including the tremendous satisfaction and feelings of accomplishment. This report, being released to Congress tomorrow, draws heavily on the more than 1,600 comments submitted by caregivers, caregiving advocates, and other stakeholders from across the country. For the first time, this report analyzes caregiving efforts across the entire federal government, including various parts of the Department of Health and Human Services, the Consumer Financial Protection Bureau, AmeriCorps, and the Departments of Education, Labor, and Veterans Affairs. As you'll momentarily hear during the presentations by the council co-chairs, we have learned a lot about caregiving, and we're poised to take the next crucial step, developing a national caregiver strategy. ACL is committed to moving expeditiously. A national caregiving strategy is long overdue, and we must seize this moment where there's a focus on strengthening the caregiving infrastructure. We will leverage our relationships with our sister federal agencies to move forward on the development of the national strategy now. We'll begin by engaging with our federal partners, followed by completing other components next. I'm confident that the result will be a strategy that will fundamentally change the way our nation views and ultimately supports caregivers. That being said, the work that this council has already done with this report being submitted to Congress tomorrow is powerful and will already have an impact. And it wouldn't have been possible without robust partnerships and collaborations. ACL is grateful to the John A. Hartford Foundation and their grant to the National Academy for State Health Policy, which resulted in the establishment of the Raise Family Caregiving Resource Dissemination Center. This collaboration between ACL, John A. Hartford, and NASIP's subgrantees at the National Alliance for Caregiving, University of Massachusetts, Boston, and Community Catalyst is an example of public-private partnership at its best. The contributions of each of these organizations has been invaluable, and I want to thank each of them for their support and partnership. I'm grateful that each of these organizations is joining us today. Now we'll be hearing from three council co-chairs, Dr. Alan Stevens, Nancy Murray, and Dr. Casey Shillum. They have prepared a presentation to provide a high-level overview of this report.
We need to share sound, please.
Council. Most importantly, I'm a family caregiver. Welcome, everyone. I'm Nancy Murray, Senior Vice President at Achieva and President of the ARC of Greater Pittsburgh. I am also a co-chair of the Family Caregiving Advisory Council. Most importantly, I'm a family caregiver. Along with my council co-chairs, Alan Stevens and Casey Shillum, and on behalf of our fellow council members, we are very excited to present this overview of the Family Caregiving Advisory Council's initial report to Congress. As you can see on our first slide, 53 million people in America are family caregivers. And while this is very rewarding work, caregiving often impacts a caregiver's physical, emotional, and financial well-being. But family caregivers are the backbone of care in the United States, but unfortunately not adequately supported by federal, state, or local policies, or by healthcare providers and employers. And unbelievably, the economic value of family caregivers is estimated at $470 billion every year, which is more than the United States spends annually on all long-term services and supports. Now, this report comes at a pivotal time in our nation's history. The RAISE Act is the culmination of 20 years of advocacy and legislation on behalf of family caregivers. It is the latest federal recognition of the importance of supporting family caregivers as a critical component of the long-term services and support system. In fact, there would be no system without family caregivers. What is so unique and groundbreaking about the RAISE Act is that when fully implemented, it will result in the first comprehensive national strategy for better supporting family caregivers. So the report that we're discussing today, which will be delivered to Congress and the rest of the country tomorrow, is the culmination of 2 years of intense, heartfelt work by my fellow council members and with significant input from hundreds of individuals and stakeholders around the country. And now I'd like to introduce Alan Stevens.
Hello, I'm Alan Stevens. I'm the director of the Center for Applied Health Research at Baylor Scott & White Health. But today I'm come to you as one of the co-chairs of the Family Caregiving Advisory Council. When the council first came together in August of 2019, we knew our task was of great significance and importance. The council is comprised of a diverse group of individuals from all over the country. I think I can safely say that I speak for my fellow council members that we didn't take our work lightly, not even from day one, and the notion that this would not be easy. We recognize that this would not be easy from the beginning. We knew that because our life experiences had taught us so. Many of us had come out of a caregiving experience, or indeed were still caregiving. So we knew that caregivers had many needs. They were diverse, and importantly, the needs were growing and growing rapidly. We, the non-federal appointed members of the council, were also realized that representatives from a number of federal agencies shared our dedication to improving the caregiving experience. These representatives from the federal agencies brought forth a wealth of knowledge that helped shape our discussion and motivated the council to think boldly about what a caregiving strategy would look like for our country. Without question, family caregiving is an intensely personal situation, and every family story is unique. But with that, the council was able to come together and decide early on what are some of the common themes that really bring caregivers together and that they share. Listed on the slide here, I mentioned caregiving is a significantly personal event, and indeed involves caregiving for someone who you have a deep personal relationship with. Caregivers step forward to care for the individuals for which they have these significant relationships in order to help the person that's requiring care maintain their dignity, independence, and overall quality of life. Caregivers do this with very little help from others, and in fact, without any kind of formal assessment to help them, guide them of what their needs are or where they could seek out other forms of support. Caregiving is also becoming intensely more complex. Individuals report that they're often are doing medical tasks and nursing tasks that they had not had to do in the past. Thus, caregiving is becoming even more complex. And lastly, research has taught us, our personal experiences have taught us, working in our communities have taught us that caregiving can have a financial, an emotional, and indeed a physical challenge or a consequence to the one who is providing care. Next slide. The work of the council would not be complete without the support of a number of other individuals who brought forth an additional perspective, additional information, and indeed helped guide the debates that we had as a council. I particularly want to thank the John A. Hartford Foundation for their funding and the establishment of the Raise Family Caregiver Resource and Dissemination Center, and the National Academy of State Health Policy, who worked with agencies across the country to make sure that the voice of the caregiver was heard and included in this report. Next slide, and I'll turn it over to Dr. Shillum.
Thank you, Alan. I'm Casey Shillum. I am Dean and Professor of the University of Portland School of Nursing. And as my co-chairs have also mentioned, today I'm here as a co-chair of the Family Caregiving Advisory Council. So after 2 years of careful deliberation and study and collaboration, we are so proud to deliver this report to Congress. This report includes everything the RAISE Act called to include and more. The council heard directly from caregivers with a variety of experiences. We engaged in extensive analysis and discussions, and we reviewed countless resources. So I'm going to provide an overview of those for you in just a moment. But these were really looking at resources that are already in place that support family caregivers. And ultimately, we developed a comprehensive set of recommendations. So the next slide actually helps us to understand some of the things that went into these decisions and these areas. So when we look at the caregiver voices, we have an incredible opportunity for us to actually hear the stories of the caregivers who have informed these recommendations. There were a number of calls that came out for information sessions, and we had 5 different council members include their statements. And there were statements from caregivers in tribal communities. And so caregiver voices really were the driving force behind the work that we've done as a council. Some of the things that we looked at in terms of analysis and that we had extensive discussions and debates and great conversations about in terms of the importance of this work, looking at youth caregivers, those who are still under the age of 18 needing to provide care for their family members and the impact that has on them in their own growth and development. Looking at international efforts to support family caregivers, understanding that family caregiving that happens in tribal communities often is very different than what we may see in other communities, and thinking about supports that are necessary for that specific group and how we can support them. And also looking at challenges faced by family caregivers. We had numerous presentations, sources of data, where we were able to hear firsthand the challenges that caregivers are facing, in addition to the experiences that all of us as council members have had in our own family caregiving. We went through a number of different sources of data, looking at analysis of multiple scholarly papers that had been presented, research, looking at Medicare and Medicaid services, advocacy work, also thinking about the importance of the Medicaid white paper that was provided by our colleagues at NASHP, and also looking at a full federal inventory of the resources that currently exist, but also identifying how those resources may not necessarily be easily communicated to those who need the services the most. And at the end, the culmination that we have in this report is now 26 recommendations that will serve as a framework and a bedrock of support for moving forward with a full-fledged caregiving strategy. So perhaps the most unique aspect of this report is that throughout the document, readers will have a direct link to real family caregivers telling their stories. You can see 3 of the amazing photos here of the family caregivers who shared their very personal and impactful stories with us. And so as you read the report, you'll get to meet 25 incredible family caregivers, and they come from all over the country. They represent a broad and varied representation of family caregivers throughout our society. As I just mentioned, we have youth providing care. We have older adults providing care for children. We have a full range of representation in these videos, and they are indeed powerful. They have supported loved ones with terminal illness, dementia, other long-term care conditions, and they've supported parents, spouses, children's, and they highlight their stories in a unique way, but yet they were joined in many ways across several common themes, and that's what has informed the recommendations. So this report, like so many others of its kind, really is a forward-looking report in scope and approach. So most importantly, it offers these key priority areas on which we must focus. And we believe that this is a strong pathway through these 26 recommended areas for action that will inform the development of a national family caregiving strategy. So the recommendations that we as a council adopted really fall into 5 broad priority areas. So these are increasing the awareness of family caregiving, increasing the emphasis on integrating the caregiver into the process and the systems from which they've been traditionally excluded. So family caregivers have not been included as a part of the care team, And that is one of the strongest recommendations that we have. We're also recommending that there are increased access, that we increase access to services and to supports to assist family caregivers, that we increase the financial and the workplace protections for caregivers. And finally, we are recommending that we need to have better and more consistent research and data collection to truly understand the impact that family caregiving is having on the health and wellness of our entire country. And so in short order, we'll be able to turn our attention into developing these recommendations into an actual strategy. So fortunately, we have the leadership of the ACL and the support of an amazing team at NASHP, who, with the funding from the John A. Hartford Foundation, will continue to ensure that we have the tools and the information that we need to take information approached in this information as we approach this important work. And so the report really is this first step, and it is helping us with implementing the charge of the RAISE Act. And so the recommendations are going to be critical for creating that family caregiving strategy at a national level, national in scope and national in focus. So it's going to encompass actions that the federal government can take within their existing authorities, as well as concrete strategies for states, for communities, healthcare providers, the system of healthcare, employers, philanthropy, and other sectors. The strategy is going to be rooted in, and it's going to speak directly to the recommendations of this report. And like so much of the report, the strategy will be heavily informed by input from the public, including the family caregivers and those who advocate for and support them. When completed later next year, this strategy is going to serve as a living and evolving roadmap for change, for better recognizing, assisting, including, supporting, and engaging family caregivers as the critical partners they are, as we all are as family caregivers, in how we support people of all ages across the care continuum who have needs. So now we would like to go ahead and open up and welcome any questions or insights that you would like to share with the council.
Thanks so much to our co-chairs for that great summary of the report. One of the things that I find most compelling about the report is the voice that it gives to family caregivers. It's not something that we typically see in government reports. And as we just heard from Dr. Shillem, throughout the document, we see and hear 25 family caregivers share their stories. These family caregivers represent both the diversity of the situations of caregivers across America, as well as the commonalities of their joys and challenges. These testimonials breathe life into and make concrete the need for each of the recommendations. Let's go ahead and play a short video that provides an introduction to all of the caregiver stories presented in the report.
Our culture, at least in my family, is that we care for folks at home. And that's hard.
My values as a Native American, that's one of the values that is instilled in us, is to care for your elders.
I didn't fully understand or embrace what it meant to be a caregiver until way, way, way late.
I don't know that I would have said the word caregiver at the time. And I don't think I even knew the word advocate at the time, but I knew that I was in some special place.
I had somebody
Are we having technical difficulties?
The video has stopped.
Hello, just 1 second, please.
Our culture, at least in my family, is that we care for folks at home. And that's hard.
My values as a Native American, that's one of the values that is instilled in us, is to care for your elders.
I didn't fully understand or embrace what it meant to be a caregiver until way, way, way late.
I don't know that I would have said the word caregiver at the time. And I don't think I even knew the word advocate at the time, but I knew that I was in some special place.
I had somebody who actually approached me and just started asking questions about how I was feeling and what was going on. And I think the light bulb went off, and it's like, oh, you know what? There are other people out there that are feeling the same way that I am.
Kimmy came home from the hospital, and for them, it's, oh, it's done. Well, not really. It actually just began for us, right?
Josh needs 24-hour hands-on care. You can't just think you're gonna sleep. He needs suctioning constantly. He's on 24-hour feedings. He needs to be turned. He's on an oximeter 24 hours. I mean, it's not like you can just say it's time to go to bed. It's not like that at all.
That's the big challenge for me as the caregiver, is I've got someone who's got some very, very serious cancer, who I believe requires 24-hour care.
The services and supports that I was trying to desperately to put in place for her, as soon as I would get a level of service in place for her, she would, her needs would exceed that level of service. So it felt a bit like being on a hamster wheel.
I mean, I wasn't sleeping. I wasn't going to the doctor for myself, surely not. I wasn't taking time for any breaks to restore myself.
I'm physically tired. Sometimes I get overwhelmed. Probably about 3 months ago, I started to get sick.
I had my first anxiety attack, so that was new for me, and that was something I've never experienced before.
We never took a vacation for the 25 years because we never thought it was going to be 25 years, right?
I've struggled with my own mental health, and seeing how my grandpa is kind of puts more weight on me sometimes. And I try to talk about it, and it could be hard sometimes. And I think it's not just me. I know it's not just me. There's lots of other people who are going through that issue.
A lot of us are compromising both our earnings and our retirement.
I am still paying off month by month those medical loans that I took out for her, which I did so gladly. But it's long-term financial implications now, even 4+ years after her death.
I've used up, what I had from 401ks to stock options. Caregiving is a very expensive experience.
I didn't put my career on hold. I just jumped right out of my career and didn't have a plan for getting back in at all, and didn't realize initially how caregiving was going to financially impact me.
There's more to us than the one story.
We don't want to end up at that destination where people say, well, I don't know anything about, I was never taught anything about caregiving, so you know what, someone else has to do it.
You're going to get sick. Your family members are going to get sick. Your kids might get sick. That is a given. So given that that's going to happen, why do we not have a solution for how to help people?
That video was just so powerful. I'm sitting here watching the chat box and it really struck a chord with so many people, not only on the committee, but the public that's participating in this meeting today. Sharing these stories is just the most powerful way that we can really move forward the issues facing caregivers and the reasons for these important recommendations. Next, I'd like to introduce two of the family caregivers introduced and featured in the report. First, I'll start with Sarah. Sarah, thank you so much for being here and for sharing your caregiver journey. You've been a family caregiver to 3 different people in your life. What have you learned over the course of that experience about why it's so critical for family caregivers to be engaged as partners in the delivery of healthcare and long-term services and supports?
Thank you for asking. I have seen both ends of the caregiving healthcare partnership. My husband, through a research facility, had a great neurologist, a social worker, and they communicated very well with both his general practitioner here locally and with us concerning what was going on. My mother, Dolly, who I was also caring for at the same time, had a nurse practitioner who did home visits and who helped us access services in the home, including x-rays and home health, which was a real gift. As you know, getting an immobile person to the doctor in my vehicle was always tricky. So I had great experience there. But on the other hand, my mother had a hospitalization and went into rehab and then finally into long-term care recently. And that's been a totally different experience. Due to COVID outbreak, there's no visitation at the nursing home where she is, which I understand. But I called last week just to get an update from a human being. And when I finally got a hold of the nurse said, "We would have called you if there was something wrong. She's fine." And I was like, okay, evidently that was too much of a bother. The person who has cared for her 24/7 for 3 or more years. There's a wide spectrum there. No one cares more about my family members than me. And no one cares more than me. No one has the experience and background that I have. So I need to be included in delivery and services and supports. Family caregivers need to be viewed as partners. Often we're unwilling partners, but we become partners and advocates, and it's critical to the health and safety of my mom and for my mental and emotional health that I be included as a valued and important partner.
Thank you, Sarah. Next, I want to call on Debbie.
Hi.
Hi, Debbie. Thank you
Hi.
so much. Thank you so much for being here today and for telling your story. Can you share a little bit more about how your experience as Josh, your son's caregiver, has impacted your views about what it means to be a caregiver?
Sure. Thank you for asking me that. It's really important to me. When we brought Josh home, he had been in the NICU for about 127 days, and we had 2 other boys. And when we brought him home, they told us that he would only live for 2 months. And then they said, never mind, it would just be 2 weeks. And so we didn't have a lot of hope in what we were told. And we knew we wanted to normalize life for Josh and for our other boys. We didn't have a lot to go on, but what we found was that we were resilient and we wanted to make a life for our family. And we wanted to learn as much as we could about what to do. I was a technical writer when Josh was born, and I did have to give up my job at about 2 years after he was born because it just wasn't working out. but I was able to take those skills of kind of gathering information and hashing it out and then asking questions about it, and just take that energy and that skill and asking those questions to learn about Josh's needs. And so looking back now, Josh is 28 years old and he's had probably 40 surgeries and countless hospitalizations. And our boys are grown up now, and Josh just had an incident where he was in the ICU a couple of weeks ago. And even last night, I was saying to our oldest boy, thank you for just stepping in and helping us as Josh went through this hospitalization and helping to us cover around the clock visitations with him in the hospital. And I said, I didn't mean to impact your lives like this. And he said, Mom, just don't say anything to us like that. And I was just so proud of them. And looking back now 28 years and seeing what wonderful young men they turned out to be, and the dedication and the sense of loyalty and family and love they have, and how that's affected our lives, our extended family, our community. And so for me, being a caregiver is being able to give the gift of quality of life to people. And it actually enhanced our quality of life in ways that I never imagined. And so to me, it's a gift. It's a skill to be able to navigate the infrastructures that we have to work within, not just learn the skills of the caregiving, but also just the skill of working within this kind of healthcare culture that is sometimes more difficult. And so to me, it's just being able to give the quality of life and the skill that comes along with it. It becomes a gift and a talent, and everything that we've had to sacrifice and give up, I would do it all over again. It's worth it 100 times over.
Thank you, Debbie, for sharing that. Sarah and Debbie, thank you both so much for being here with us today and for giving voice to so many other people who are in situations similar to yours. I'm now going to turn over the agenda to Greg Link, who will moderate the rest of today's meeting, and I'll be back at the end of the meeting.
Thank you so much, Allison. It's really great to see everyone. Debbie and Sarah, thank you both so much for sharing your stories. We did have a third story, a third caregiver planned to share a little bit about her story. We saw her in the video. Her name is Sherry. And unfortunately, her husband, whom she was caring for, passed away during the night and so was not able to join us. But it's testament to the fact that this caregiving situation that so many of us have faced and still face can change on a dime. And so we just want to express our condolences to Sherry and also her our extreme gratitude for sharing with us. And you will be able to see her story in the report that we deliver to Congress tomorrow. It's also, I think, worth pointing out at this stage that many of the caregiver stories that you see will have already experienced some changes since their interviews were completed several months ago and at the height of COVID. So where they say they were then, they may not be now. But we do, we wish the caregivers all of the best, and we thank them so much for sharing with them. I want to add, as having been the person who has led this effort for ACL as a designated federal official now since the start of the project, I just want to extend my gratitude to the members of the council who have guided our work, who have really poured their hearts and souls into this report that we're delivering to Congress. And Cheryl, would we be able to just call each person, each council member, federal and non-federal, who is on today, so that folks can acknowledge them and see the individuals behind this important work?
Sure, thank you very much. Allison Barkoff, Alan Stevens, Benjamin Olivari, Brenda Gallant, Bruce Fink, Carol Zernial, Catherine Alicia Georges, Diane Caradu, Helen Lamont, James Murtha, Jody Sumaraki, Joe Caldwell, Catherine Capana, Lisa Schifferly, Margaret Cabot, Nancy Murray, Rhonda Montgomery, Rosemary Payne, Teresa Tanus. And I believe we have all of the council members that are on.
Great, thank you so much. And in addition, I have to, as the council members and Allison acknowledged, the support from the John A. Hartford Foundation and the guidance and insights of both Ronnie Snyder and Scott Bain at the foundation, and also our incredible colleagues at NASHP, Wendy Fox Grage, Kitty Purington, Salome Tashale, Luke Pluta Ehlers, and the work of the National Alliance for Caregiving, Grace Whiting and Mike Whitkey. We wouldn't have these stories and the voices of the caregivers so eloquently infused into the work were it not for the support of the John A. Hartford Foundation and the participation and hard work of so many partners on this. So as Allison mentioned in her remarks, we're celebrating today the release of the report and delivery of the report to Congress tomorrow. And we are very quickly now beginning to turn our attention to the development of the National Family Caregiving Strategy. And we thought that to get that process underway, it would be really good to begin with a look at what's happening at the federal level. With some key administration initiatives and priorities, as well as having a bit of an overview and a table setting, if you will, for some of the federal the activities going on in Congress, but also around the country. And so I'm really excited that we have this panel, 3 presenters here to talk with the members of the council and field some questions afterwards, which will hopefully begin to pivot our attention away from the development of the report and then focusing now on the National Family Caregiving Strategy. So to start us off, I want to introduce everyone to Jessica Schubel. She's the Director of Affordable Care Act and Healthcare at on the White House Domestic Policy Council. Jessica has worked at the Center on Budget and Policy Priorities, where she examined issues related to Medicaid and other coverage issues. And then prior to her role at CBPP, Jessica served as a senior policy advisor to the director of the Center for Medicaid and CHIP Services at CMS during the Obama administration. And prior to that, she worked at DC's Medicaid agency. Born and raised in Western New York, Jessica graduated from Syracuse University and the George Washington University. And Jessica's going to give us an overview and some insights into some key administration priorities that that the council should be aware of and be considering as we look to begin developing the strategy. So Jessica, I'm going to turn the floor over to you.
Great, thanks Greg. Can you hear me okay?
Yes, we can.
Great. Well, really excited to be here to talk about long-term services and supports and the critical role that family caregivers have in providing these services, and how the administration is committed to not only expanding access to Medicaid's home and community-based services, or HCBS, but also to family caregivers. As Greg mentioned, I'm the Director of the Affordable Care Act and Healthcare at the Domestic Policy here at the White House. And in this role, I oversee the Medicaid and ACA or private insurance portfolios. And I work closely with Greg and Allison and the staff and team at ACL. So very excited to be here again. I don't have slides today, but what I thought I'd do this afternoon is talk about what the President has done so far to strengthen Medicaid HCBS through the American Rescue Plan, how he's proposing to continue that down payment through his Build Back Better agenda, as well as how Build Back Better will support family caregivers. President Biden believes healthcare is a right, not a privilege, and that is why he is committed to investing in home and community-based services under Medicaid. As you all know, these critical services allow millions of older adults and people with disabilities to receive healthcare services in their homes and communities, rather than in nursing homes and other institutions. The administration recognizes what you all know, that your loved ones want to remain in their homes and communities to get the care they need, and that you, as caregivers, need more support. That's why the president is committed to ensuring a robust and sustainable HCBS system that supports both Medicaid beneficiaries and the caregivers that provide these critical services. You know, I actually just saw a study this morning showing that expanding access to HCBS helps improve family caregivers' mental health, which brings me to the American Rescue Plan. It provides a down payment on the president's commitment, which is providing additional Medicaid funding to states so they can not only expand access to HCBS, but also enhance and strengthen their programs. States can use this additional funding to do things like expand the use of telehealth, reduce wait lists, help more people with upfront transition costs like paying for security deposits or utility bills. But I also want to flag that this additional money can be used to support family caregivers during this time. For example, states can use this additional funding to provide respite care for family caregivers. Respite care is critically important. We know that family caregivers need a break from caregiving. It's important to your well-being and mental health, which is why we're committed to helping states make these services more available. The American Rescue Plan funding can also be used to support family caregivers with needed supplies and equipment, which may include items not typically covered under the Medicaid program, such as PPE. And it can also be used to help you, as family caregivers, get paid for your caregiving work. I know some states already have programs in place to allow family caregivers to enroll as Medicaid service providers, but we're hoping that more states use the American Rescue Plan funding to establish or expand these programs. The money can also be used to help families schedule vaccine appointments or provide other vaccine-related supports, such as transportation to vaccine sites. It can be used to develop and implement in-home vaccination options as well. Finally, the American Rescue Plan's additional funding will also enable states to strengthen and enhance their HCBS programs by allowing them to increase wages and provide paid leave for home care workers, conduct workforce training and recruitment activities, and implement quality improvement initiatives. I just want to pause here and reiterate that this funding can be used to help provide more family caregivers with the training and information they may need to help perform complex caregiving tasks. Under Build Back Better, the President is committed to continuing the opportunities I just mentioned with respect to strengthening HCBS and its workforce, especially for family caregivers. There are two policies in particular in the Build Back Better agenda that I'd like to call out. First, the President is calling on Congress to invest billions of dollars towards expanding access to quality HCBS services while creating new jobs and supporting efforts to increase wages, as well as provide health insurance, paid leave, and other benefits to caregivers. The President's proposal will also improve caregiving training and other career advancement opportunities. Build Back Better also calls for an extension of the long-standing Money Follows the Person demonstration program. This program has successfully transitioned over 100,000 people back into their homes and communities, while also supporting innovations in the delivery of long-term care. Build Back Better will help strengthen this program and build on its successes, allowing more family members to move back to their homes and communities, as well as innovate in care delivery. The other set of policies that I want to mention, and by no means am an expert on, I will just flag that, centers around paid leave. Under Build Back Better, the President is proposing to create a national comprehensive paid family and medical leave program. This program will ensure folks receive partial wage replacement to take time to care for a seriously ill loved one, heal from their own serious illness, or take time to deal with the death of a loved one. This program guarantees 12 weeks of annual paid parental, family, and personal illness leave, and also ensures workers get 3 days of bereavement leave per year starting in the first year of implementation. The plan has an inclusive definition of family, ensuring workers can care and be cared for by a loved one who is not related by blood, which will greatly benefit many communities, including the LGBTQ+ individuals and people with disabilities. The President is also calling upon Congress to pass the Healthy Families Act. This act will require employers to allow workers to accrue 7 days paid sick leave per year to seek preventive care for them or their family. The COVID pandemic has heightened the need for a national paid sick leave policy to help workers and their loved ones quickly recover from short-term illness and prevent the spread of disease. So thank you for letting me share the administration's priorities with you all. And Greg, I'll turn it back to you.
Thank you so much, Jessica. We'll save questions until the end after we have our second speakers on, but I want to thank you for providing that wonderful context. The administration, all of their key priorities and initiatives that they have going on that really will, I think, help provide so much important context for the council as we begin to work on the National Family Caregiving Strategy. Next, I want to invite our partners at the National Alliance for Caregiving. Grace Whiting, who is president and CEO of NAC, is really one of the nation's leading public policy and advocate organizations for family caregivers. Grace has been at NAC for quite some time and has served as both the COO and the Director of Strategic Partnerships before becoming CEO. She's an attorney in the DC area and is just a wealth of information about the caregiving research and the policies and programs that are necessary to support family caregivers. And then her colleague at NAC, Mike Whitkey, who is the Senior Director of Public Policy and Advocacy. Mike oversees the work of the NAC's National Caregiver Advocacy Collaborative. It's a network of nearly 100 national, state, and local family caregiver advocates from across the country. Prior to that, coming to NAC, Mike was the Associate Director of Government Affairs at the National Association of Home Care and Hospice. And so I welcome Grace and Mike. They're going to sort of provide a bit of a legislative context and a legislative update, some of the things that are happening in Congress, but also around the country with respect to things that you all as the council and that we, as we begin to support you in your work to develop the strategy, need to keep on your radar screen. So with that, I'm going to turn it over to Grace and Mike, and you guys can take it away.
Thank you, Greg, and thank you, Jessica, for your overview. You may recall seeing Alan in the video, or again, my name is Mike Whitkey. I'm the Vice President for Research and Advocacy at the National Alliance for Caregiving. Grace, you can go ahead and go to the next slide, and I can get started with my comments here. Okay, so you may recall seeing Alan in the video earlier. He said, I have someone with some very serious cancer who I believe needs 24-hour care. At the time we interviewed Alan, he was caring for his terminally ill wife in their home. Just prior to her diagnosis, they had adopted 3 young girls from India and were in the process of welcoming them into their lives. Sadly, not long after our interview, he emailed us to let us know of his wife's passing. He sent us this picture so we could honor her and their family. A couple of months after we heard from Alan about his wife, we had a hard time getting in touch with Gabe, another one of the caregivers you see in the video. It turned out that now his grandfather had recently passed away as well. Then, tragically, even in preparation for this event, Sherry, one of the caregivers we plan to have with us here today, and also seen in the video, lost her husband just last night. These stories remind us that the caregiver experience is dynamic. It is a journey that is not always linear, predictable, or consistent. And it was an honor to interview these caregivers featured in this initial Race Council report and help make sure that their voices are heard. Hello, everyone. Thank you again for having us here with you today. Again, my name is Mike Whitke. I'm the Vice President for Research and Advocacy at the National Alliance for Caregiving. And it was a privilege to participate in this major milestone, a next step towards a more person and family-centered and proactive family caregiver support infrastructure. The work the Council has done to establish this initial set of recommendations will set a course for the development of a National Family Caregiving Strategy that will provide a roadmap for policy implementation. This federal stamp of approval validates the painstaking work that countless people have done in the recent decades to understand, define, and spread awareness of this once invisible population. I mentioned Alan, Gabe, and Sherry earlier, not only to honor them during this event, but also make the point that similar to the dynamic nature of the caregiver experience, caregiving in America is an issue that is also dynamic and evolving. This is evident by the fact that this issue has not only risen to the highest office in the land, but is an issue that is high on the president's priority list. Nobody wants to see the national strategy turn into an obsolete report that sits on a shelf. In a moment, we'll cover specific and concrete examples of current legislative proposals that comprise today's caregiver policy landscape and how those proposals align with the Council's recommendations. But how that strategy is applied for action is just as critical of a detail. There's legislative language codified in the Race Family Caregivers Act, in a nutshell, that says after the creation of the national strategy, every other year, the Secretary must update and republish the strategy to reflect new developments, to review progress of the strategy, and to recommend priority actions for improving the implementation of such recommendations. This is important because a successful national strategy will require a process to ensure this remains a living document. However, the legislative authority directing these updates to occur expires next year. It's important the national strategy includes a realistic plan to revisit and update the strategy beyond the expiration of the RAISE Act in 2022. Let's make sure this work you all have done moves to the next step and receives the ongoing and consistent attention that is required to become reality and adaptive over the long term. Now let's get into some more specific details about the legislative landscape. Please welcome our colleague and next President and CEO, Grace Whiting. Thank you very much.
Thank you so much, Mike. And I just want to say, following on your remarks, this really is a bittersweet moment for our community because so many of the caregivers that all of you work with every day are dealing with complicated grief or even recent grief or dealing with the experience of having cared for someone and having that life-altering experience. As I've heard caregivers say to me before, no one wants to be a caregiver, not because it's not an important job. It's an important job. It's an opportunity to honor the people you love, but it also means that someone you love is sick or has a disability, and that can be a very heavy strain to carry. So we're going to talk a little bit about what happens next on the federal level, what types of opportunities there are. And I just want to extend my thanks and gratitude to the work of the RAISE Council for creating such a thoughtful, impactful report, to John A. Hartford Foundation and Nashby for their leadership, to Greg for his leadership, to Allison Barkoff for her talking so openly about caregiving within this administration, and of course to President Biden and his administration. I have to admit that in the joint address to Congress this year, when President Biden started talking about caregiving, I was literally cheering from the floor of my living room and, throwing my hands in the air because it's so exciting to see this momentum that we've built together as a community. With that in mind, I want to give you a sense of how we see the issues and where we think there are some really exciting opportunities to get engaged. So you'll see on the screen here a diagram, and these two worldviews really that we observe when it comes to caregiving. There's the worldview that caregivers are really partners and care providers. And there's a number of federal programs that support that role of a caregiver. Everything from the 1915 Medicaid home and community-based service waivers to incentives for providers to provide family support, such as the Chronic Care Management Billing Code, programs like PACE or the VA Comprehensive Assistance for Family Caregivers programs. And each of these programs really identifies places where, by supporting a caregiver, the person who is receiving the services can also have better quality of life, better health and wellness. On the right-hand side, you'll see so many of the programs that we're familiar with. And I think of these as programs that offer caregivers self-determination. It recognizes the caregiver's own dignity and independence and the need for them to have support. And of course, we've been so thankful for President Biden and his administration's continued support of the Aging Network, and in particular, the National Family Caregiver Support Program through new funding that's been secured, as well as Lifespan Respite Act and other home and community-based service programs. There are also public health initiatives like the Behavioral Risk Factor Surveillance Survey and private sector initiatives like workplace accommodations or even legal protections available through laws like the Americans with Disabilities Act. Now on the next page, I'm going to give you a snapshot of how we've been thinking about these issues. We've heard about these 5 different pillars, and I'm going to highlight for each of these 5 pillars places where I think there's low-hanging fruit, where there's something exciting coming up on the horizon, and where there's opportunities in the longer term to really shift the paradigm of how we think about caregiving, to make sure that caregiving is central to our nation's public health. So on this first slide, we're going to take a sneak peek at some of the legislative initiatives. If we go on to the next slide after this one. So for each of these slides, I tried to identify which goal, although as you may have noticed reading through this report, so many of these goals are cross-functional. Here we're thinking about this issue of awareness. How do we improve the awareness of the caregiver's physical, emotional, and financial well-being? And so by example, we're looking at recommendation 1.3, improve outreach efforts to family caregivers to ensure identification and access to supports and services. As we've looked at the research around identification, it's clear that not every caregiver is going to feel comfortable raising their hand and saying that they are a family caregiver. In fact, about half of caregivers will resist doing that because they're concerned that caregiving will engulf the other roles in their life. In some subcultures within the United States and truly around the world, we've also noticed that people sometimes resist saying that they're a caregiver because the idea that you could ever say, no, I'm not going to take on this role is not always something that's culturally competent. So what we identified here is first just the leadership that's happening in caregiver assessment, recognizing that systems, not individuals, should be the ones to reach out and identify the caregiver, assess their need, and get them the help they so deserve. We are building here on leadership that we've seen from Family Caregiver Alliance, AARP, and others, where they start to really think about how assessment works in models of care delivery, particularly under the Medicaid program. So what's happening next after we build from that base of assessment? The BOLD Act Infrastructure for Alzheimer's Act takes that idea of really recognizing the caregiver's role and applies a public health lens. Now, while the BOLD Act has already been enacted into law, it is currently in its implementation. And this is an opportunity for national stakeholders to get involved, to better understand how the BOLD Act works, to help expand lessons learned from the BOLD Act to other areas of the healthcare system, and to continue that focus on public health. Finally, some researchers, including leaders such as Jennifer Wolfe at Johns Hopkins, have been thinking about family caregiver assessment in primary care. Imagine a world where, in the same way that your doctor may ask you whether you've been smoking, how often you've been drinking, that they're also asking you about your caregiving responsibility, not to take it away from you, but to recognize that it can be a risk factor for your health and wellness and that you need additional support. This is the model we see in the U.S. Department of Veterans Affairs that has been so successful at helping to continue to support our wounded warriors. And it's an opportunity for us as a community to think big about what awareness and outreach could look like. On the next slide, we take a deep dive in a different area, goal 2, thinking about caregivers as partners. And here we're launching from recommendation 2.2, which is to identify and include family caregivers as essential members and partners in the care recipients team. Now, all of us, I think, are aware of the State Care Act, an amazing, innovative law that requires that caregivers are included in the discharge from hospital to home. It requires the identification of caregivers within the healthcare record. And we know that people, for example, at Rush in Chicago have been thinking about how that actually works pragmatically. As AARP has continued to expand that initiative, it has now reached over 40 states. And there's opportunities there to continue that momentum. But when we think about what's happening next, there are other opportunities that we maybe haven't thought about before. And one of those is where caregivers fit within biomedical innovation. In fact, currently the FDA is in the process of negotiating the reauthorization for its Prescription Drug User Fee Act. And embedded within that very comprehensive piece of legislation is a discussion about the role of patient and family engagement in the design of new medicines and therapies. This is a chance to remind FDA that the person who may be sitting at your side during a clinical trial is a separate human being from the patient, and they provide their own source of data, their own insight, and they need support in order to be effective care partners. Likewise, the U.S. House Energy and Commerce Committee has introduced a discussion draft of its 21st Century Cures 2.0 legislative proposal. And within that proposal, there's an entire section that is dedicated just to supporting family caregivers in biomedical settings and offering training so that they can be better equipped to do the work that they do every day. Finally, some providers such as CMS and some communities such as Alzheimer's and cancer or oncology have been thinking about how providers can be reimbursed for the services that they give to a caregiver and for that inclusion. How do we make it easy for people to say yes to the member of the caregiver being part of the care team? And there is even new research from folks like Blue Cross Blue Shield looking at claims data, and in particular, looking at claims data of patients and their caregivers within the same health system to determine what the cost is of caregiving if we don't support it. These opportunities, these new ideas, provide really concrete mechanisms for us to better include the caregiver in care delivery models. On the next slide, we also talk a little bit about goal 4, income security. The big exciting thing here, and something that this was part of my cheering when listening to the president's joint statement to Congress, was the movement on federal paid family and medical leave. And in fact, Chairman Neal's proposal at the Committee for Ways and Means would offer wage replacement and income replacement for workers with caregiving responsibilities. It's a broad definition that includes not just families that are legal families and families of kin, but also other people with whom you might have a significant relationship. And this is an exciting moment where something like paid family and medical leave is beginning to garner support even from the business community, whether it's the US Chamber of Commerce or associations like ERIC, which represent ERISA's strategy. Those associations are recognizing that paid leave is building momentum in the states and that a federal solution might be something easier to implement for businesses and a win-win in recognizing the importance of caregiving. On the horizon, we can see tax credits for caregiving, where the Bipartisan Credit for Caring Act, led by AARP and others, would offset caregiving expenses for the middle class. And then in the big picture paradigm shifting landscape, caring across generations, and colleagues within that broader direct care workforce and family caregiving community have been discussing an idea of universal family care, like a type of care benefit that would give people new flexibilities and recognize that care work itself has value. On the next slide, there are places on the plan where we can see some opportunities, but we also see places where we can continue to grow what's already been planted. And here we took a peek at goal 3. Goal 3 is really focused around this idea of having access to an array of flexible person and family-centered programs, supports, and goods and services. And there's a couple of projects and initiatives out there in the world right now that we think are going to be instrumental in implementing this part of the plan. Notably, the Diverse Elder Coalition's research and training with family caregivers in diverse communities provides really important insight into how we can have culturally literate, relevant, genuine, and authentic support for family caregivers regardless of background. Likewise, groups like the Elizabeth Dole Foundation have begun looking at the types of caregivers that sometimes we forget. In this case, young caregivers. This would be children in the home that help care for an aging relative or a wounded warrior in particular. And what are the needs of those children? And likewise, groups like the Caregiver Action Network are leading an effort known as the Community Care Corps, which creates new opportunities within states and communities to provide support. We've been particularly impressed in Maryland, where the Caregiver Service Corps allowed volunteer caregivers to provide a rapid response to families during COVID-19. On this next slide, this is the last sort of peek at the plan, looking at Goal 5, research and data gathering. And here I have to give so much credit to the CDC for the work that they have done over the years to support the Behavioral Risk Factor Surveillance Survey. There's an opportunity there to continue expanding the caregiver question within the BRFIS in order to collect better caregiving data in each of the 50 states and our territories. Likewise, centers at the National Institutes of Health, particularly the National Institute of Nursing Research, have just completed a new strategic plan. And within that strategic plan, there's identified opportunities to fund new research on family caregiving. Continuing to push various centers of HHS to think big about funding research and caregiving is one way to really strengthen that community. And finally, I'll just mention that many of our global partners are working on how we can share common messages across borders. The International Alliance of Care Organizations has released a global state of care report profiling caregiving best practice in 9 different nations. And there are efforts to estimate the number of carers around the world so that we can get attention from the United Nations and the World Health Organization. On the next slide, one last thing I want to just leave you with is looking back at the legislative text of the RAISE Act. It talks about the importance of creating more efficiency in government. And we think there are probably 2 ways to do that. One, picking up on what Mike advocated for, is continue the RAISE Council. Caregiving is a dynamic, changing, important piece of work. And to continue bringing the communities together, it needs to have a long life. And second, think about aggregating what we know right now about caregiving across government agency, something like caregiving.gov, where centralized information is easy to find for any caregiver across the lifespan. On the last slide, I just want to again extend my thanks to all of you for what you do and for continuing to put the needs of America's 53 million caregivers really front and center. Thank you so much.
Thank you, Grace. Thank you, Mike and Jessica. For the members of the council, we have some time left. And if members of the council have specific questions, as you begin to think about how you would incorporate the information that you all just heard from Jessica, Grace, and Mike, are there specific questions that you all would have of them while we have their expertise right here with us? I would say in the same room, but kind of on the same computer screen. Council members? Yes, there is a Catherine Georges.
My question is, in Ms. Whiting's piece, she talked about the CARE Act and some of the other things that are going on. How much should we emphasize some of these as part of a national strategy, since many of them are just state specific? They did not emanate from any federal agency. Just a thought about that and the feasibility of doing such a thing.
So I would say a couple things about the CARE Act. I think the first thing is that the CARE Act is really limited to that hospital to home transition. And there are probably other transitions within the healthcare system that need some attention. So for example, if I am a Medicare beneficiary and I get a hip replacement and then I'm discharged to a nursing facility, how are caregivers included in that process? And that question is not something that's really easy to answer just immediately. So I think from a national strategy standpoint, there's an opportunity here to say, here's what we know about the CARE Act. AARP and other evaluators have begun to collect data on its efficacy. So we know what works. Will that same model work in other care settings for other types of patients or families as a whole? So I think from a national strategy standpoint, understanding how we integrate caregivers into care delivery models is really important. And the CARE Act work can really be sort of a laboratory to help us better understand how to do that.
Thank you. Alan, you have a question?
Yes, thanks to both of you for excellent presentation and really for going the extra mile of linking very specifically to the recommendations of the council. I was really in tune with the statement of taking a systems act regarding some of these issues that you talked about, and in fact, making the systems take the lead in terms of asking questions about caregiving. What are your thoughts about how that could be created to include greater buy-in or greater partnerships that are private and public partnerships rather than exclusively legislative action? And that is, what can we do to get some of the private industry to help support the system changes that are needed?
So one thing that comes to mind is how it's handled in other nations. So of course, if you're in a nation with a socialized health system like the United Kingdom, it's a little bit easier because you have a common entry point. And I can see several colleagues here in the chat talking about, one of the challenges we have in the United States is we don't have that common entry point. This is where I think a public health approach could be very useful, because that is a way to cast a wider net. In some nations, they use a standardized assessment tool called the Inter-RAI, which is also the basis of some of the assessments under Medicaid home and community-based waiver programs. But having that standardized tool kind of allows people to map out where you might direct someone afterwards. I think to incentivize providers to do that, there's a question about what the evidence is that it's going to improve health overall. And to me, this is where the Blue Cross Blue Shield study is helpful. There is some limited data about the caregiver's ability to support the health and wellness of a patient or a person that requires care. But in some conditions, such as mental illness, you might not be able to show a really firm return on investment because the types of high cost services like hospitalization may not apply for all types of diseases. So I think that Blue Cross Blue Shield study poses really interesting approach because it looked at those families where both the caregiver and the person who needs care are on the same health insurance plan. And it says basically that caregivers have difficulty coping, and that drives up their health cost. In a capitated model where my entire family is insured under this one model, that means that there's an incentive to me to try to help the caregiver because they're also driving costs. So I think it requires that public health approach and also an understanding of what is the impact of care on the family caregiver's health, wellness, finances, education, and so on.
Yeah, thank you. If I can do a follow-up. I agree on the long-term health impact and the need to assess that, and absolutely. My fear is that we still aren't doing enough to improve the process of engaging caregivers into care for us to see what is the potential impact. So that return on investment, I think, is very hard to prove right now because we've done so little to actually be able to change it. The CARE Act gets a lot of attention. I know I support it, it's valuable. We also know it's not very well adopted by many hospitals. Which brings up my other question is there any room to look at or any opportunities to look at some of these issues from a regulatory issue? That is, the CARE Act is yet to pop up on anything related to Joint Commission. Are there any opportunities to work with CMS and other or the regulatory side of CMS, perhaps FDA, other agencies that have regulatory responsibilities to look at changes that might make some of these care delivery innovations occur more quickly?
So I'll just offer, I definitely think FDA is open to it within the context of clinical trial design. Part of it is that there's not a lot of research on how that works. So not just the identification of the caregiver, but also what is it that they're doing within the trial, what kind of support do they need? So I think it's an area that needs more research. On the regulatory side, within the header of sort of CMS and particularly Medicare and Medicaid programs, I will just offer that NEC has been trying to map out the billing codes under the Medicare program that allow for reimbursement for family support services. The challenge we're running into is, of course, if I have a Medicare patient and I have something like a chronic care management code that lets me provide services to the family, that caregiver is not my beneficiary. So I'm restricted from a regulatory perspective in what type of support I can really provide the caregiver. So there's a lot of sort of tangled issues there where I think private sector folks want to do the right thing, but outside of managed care models and plans that are really working with sort of a whole family approach, it's really hard to do that because not only because they don't get paid for it, but because it's just really hard to track the data.
Thank you. Thank you very much, Grace.
Grace, before we move on to the next question, somebody in the chat, you named or described or named a standardized assessment tool that's available internationally. Can you repeat what that one is?
Yeah, it's the Inter-RAI one. And actually, the Family Caregiver Alliance, in their paper where they talk about caregiver assessment, they talk about that as a baseline tool. But that's one that's used by several European colleagues, as well as in Australia and New Zealand. They use it sort of as a base.
Thanks. Carol, you had a question.
Yes, thank you. This question is for Jessica. I'm wondering if there are lessons learned from the Affordable Care Act as we think about the caregiving and what's going on with families and the demands on them for caregiving. We used to think that health insurance for everyone was a remote possibility, and we're seeing how popular it is and how it's become, even more accepted across the population. What are the lessons learned that we could apply to the strategies we want to implement for caregivers?
Sorry, I have to unmute myself through different mechanisms here. I think that's a really an interesting question. I hadn't really thought about that in the context of caregiving. I think, the one thing that, I guess the parallel thing between the two, at least in my mind, is that everybody needs it and everybody benefits from it, right? Like at some point and everybody needs health insurance. And so the Affordable Care Act really made sure that that was possible. And, at some point in our lives, we're going to need caregiving. And I think, folks should, the lessons learned there is trying to make this as tangible and kind of talking about it in a life experience. So it's not some kind of conceptual thing, because I think, as COVID has shown us, at least with health insurance, for example, it's very important to have. And I think, having, systems in place to ensure that when people do in fact need caregiving, it's available, that their families are supported, whether it's through paid leave, sick leave, having the training and necessary, information provided to them. I think that those are kind of the important pieces. I'm not sure if I answer your question. I'm kind of like noodling over it in my head, and we'll probably do a little bit more thinking because I hadn't thought about it from that frame.
No, thank you.
There's a question that came up earlier in the chat. I don't know, Grace, this might be something that you can speak to, Grace or Mike. Can you speak to why the Social Security Caregiver Credit Act has not gotten a lot of attention thus far? Do you know much about that? Or
I'm actually going to turn to Mike on this one. I think one challenge with the Social Security credit, just broadly speaking, is that it would cast such a wide net, and I think there's some questions about cost. But Mike, certainly you can speak in more detail to it.
Yeah, I saw that question pop up earlier, and I was kind of noodling on that as well. One of the things, just from a positive standpoint in terms of attention is actually in terms of really specific and targeted legislative proposals that were identified and listed in the Biden proposals under this administration, and even going back when he was campaigning for president, was tax credits and Social Security credits. So it's actually one of the few really specific proposals that is showing up for caregivers in Biden's plans directly to support caregiver financial security issues, aside from things like paid leave. The bill itself in Congress hasn't gotten a lot of bipartisan attention, so I worry that it's sort of fallen into this partisan gridlock issue that a lot of bills fall into. Not that it wouldn't be a good idea, or not that it wouldn't be something people would be interested in. I think it just needs a lot more advocacy and a lot more attention, and described as sort of a bigger piece, as a piece to a bigger puzzle of support, and not one standalone bill that would be sort of a fix-all type of issue.
Thanks, Mike. Council members, any other questions while we have these three incredible minds with us?
Hi, Greg. This is Deborah.
Hey, Deborah.
Hi. Thank you, Grace, Mike, and Jessica for being here with us today. I guess as I'm mulling over the ideas of paid family leave, of tax credit for caregiving, I'm wondering if you all would have any advice for us in how to be sure that the family members, a lot of the stories we saw involve older individuals. As family, we care for our aging parents, our grandparents. They are not dependents as such, like on our income tax forms. So what kind of strategies could we utilize to be sure that caregivers could be included in paid family leave, these types of initiatives that would then support them for an individual who's technically not a dependent, but who needs care to remain at home and not in an institution?
So I think I mentioned this in my remarks, but I know, and I should start and say I am not an expert or the person that oversees kind of our paid leave bucket of work here at the Domestic Policy Council. But when I was chatting with her in preparation for speaking with you all this afternoon, she mentioned to me that there is a broader definition that folks are, that we are trying to prioritize and push forward that would, make sure that caregiving is of a loved one is a broad term. And so I think that perhaps might get to what you're asking, Deborah, in terms of who would, I guess, qualify as a caregiver for these things.
And if I may just add to that, Deborah, if you look at the House Ways and Means Committee page, they've got some amazing summaries of sort of what they're thinking in terms of how something like this might work and what types of relationships. One of the things that surprised me the most is that they're even indicating, at least in the discussion draft, that if you were self-employed, that you might still be able to qualify for paid family leave, which is pretty progressive and kind of a new idea. I would also just encourage the committee to think about other ways to support caregivers at work. One challenge for a lot of mid-career women in particular is they step out of the workforce to care for someone, and they don't really have a good path to get back into the workforce. And so there's also a piece here, I think, about discrimination, whether it's age discrimination or just discrimination against, workers who have care responsibilities. Some of that has changed under COVID, But that big question about what does a caregiver friendly workplace look like, the more progressive companies we're seeing are sort of changing that from a conversation about benefits to really thinking about caregiving as part of diversity, equity, inclusion, and belonging, recognizing that, you know, caregiving as an identity is an important part of who we are, and that allows us to bring to the workplace resources, ideas, resilience that maybe others may not have because they've never had that caregiving experience.
Yeah, and then just last to add, I agree. I think the definition part is important. You can be eligible for some of these things like tax credits and paid leave without having to be, you know, without the dependent status, but the education and sort of awareness, like, do the caregivers understand that they fall under that eligibility criteria, which I think is pretty key here, that education piece. You are eligible for this. You may not realize that is a critical part of these proposals, and really something that would be important for the national strategy to take into account as well.
Grace, there was a question in the chat. Somebody was interested in hearing your thoughts on what a comprehensive public-private approach to ensuring respite for all family caregivers might be. That's a big question, but got any ideas?
I think one thing that would be helpful would be to bring together some of the home care providers, some of the large companies that offer home care, as well as the advocacy organizations working with direct care workforce, and really talk through what, you know, what we know about respite that works and what needs more flexibility. And I haven't seen that happen per se, because sometimes there's some tension there between, for example, a group like PHI, who's really advocating for direct care workforce, and a home care company that may or may not have the same opinions about sort of labor rights and those pieces. I think it's still possible to get those folks around the table. And of course, you know, Home Instead, I have to give them credit for their leadership on the World Dementia Council, being part of this council. So I think there's opportunities there to get the folks in the same room. And that, because sort of underlying the respite shortage is a worker shortage. So the workforce issue has to be tackled. The other piece of this, I think, is, you know, as lawmakers are working with these programs, thinking about how they can be more flexible. One of the things I think about, for example, on congregate meals, how many millennials, myself included, have no idea how to cook? Wouldn't it be nice if my grandmother and I could both get a home delivered meal and have the same meal together, or use something like HelloFresh and, you know, we create a meal together and have that shared experience. But a lot of these programs are pretty restricted to the beneficiary, not to the family. And so activities that could happen in family units are sort of hard to mold out of that. So I think there's some opportunity to sort of reevaluate some of the regulatory side and think about, can we free some of this up for innovators to be more flexible?
Great, thank you. Other questions? Anybody, council members? Debbie Simmons.
Hi, I would just like to add to the respite question. I think it's important to add families at the table to describe exactly what is most useful to them in terms of respite, and to define respite themselves. I've had respite defined for me by county and state case managers and so forth. And in our situation, for example, we've been offered respite for a weekend for our son, but that would mean that we would have to pack up his ventilator, his oximeter, his oxygen tanks, all of his disposable supplies, and pack him, get him into the van, travel, unload all of that, orient someone to his cares, and set up all of that equipment, and then leave him at that place, and then come back, and then, disassemble everything and bring him back. And that, to us, and also worrying about someone being trained for that short period of time, is not respite. It's extremely stressful and tiresome. And so for us, respite would be perhaps like allowing nurses who already know our son just to be able to stay at our home over the weekend, where everything is set up for him and he's already familiar with the environment and comfortable. So I think it's extremely important to allow families to define what respite is in their particular situations.
Thank you, Debbie. Excellent point. Rhonda.
Yes, I really appreciate that last comment. Respite isn't respite if it takes too much energy, and it's not about money as much as it is about the energy. And I think that's incredibly important, to have that ability to have respite in your home without having to train a new person and all the effort that goes with it. I really appreciate your comments, because they are so true.
Thank you.
Greg, it's Nancy.
Yes, hey, Nancy.
I would just like to say that, since we're talking about respite is a wonderful idea. But right now in the United States, we don't have enough paid caregivers. We don't have enough direct support professionals. Here in Pennsylvania, we now are seeing the collapse of our system because we can't pay them high enough rates as opposed to them working at Amazon. So I think more and more our family caregiver strategy is tied to the other issue of paying caregivers, direct support professionals who are not family members, but paying them, livable wages, because without them, we don't have respite, but we don't have a lot of other home and community-based services.
Correct. That's a great point. Kind of have to start at home almost.
Yeah.
With what you have. Other questions? We have a few more minutes left in this time period. Don't want to cut anybody off. Yes, Rhonda again.
Again, I really appreciate that last comment. Nothing is going to get better if we don't deal with paying the caregivers, the paid caregivers. And that's not just in community settings, that's in nursing home settings and memory care settings. That's getting people who are able to do that, and who it's all about making them have a living wage. So, one of the other major issues that occurs both in institutional facilities and at home is you get somebody set up, but then their own personal needs, because, the car broke down, this broke down, their own personal needs make it impossible for many of them to keep a schedule, which then plays out for what happens to the family caregiver. So we cannot overemphasize the need to figure out how to pay paid caregivers.
Okay, that's a great point. And I think, as we look to the development of the national strategy, I believe that there are a couple of very broad recommendations that I think may give you guys an opportunity to begin to explore some strategies, whether they're in the private sector or in the more publicly funded sectors. So we will definitely flag that. James.
And unmute myself. Thanks, Greg, and thanks for joining. This has been so informative and helpful, and this is going to really help us with directing our vision going forward and helping us set our compass. And thank you for that. And if we could get, I know the slides for the National Caregiver Alliance are going to be available. I was curious if we could get, if it's not like readily available, if we could get some summary of what was gone over first with Jessica, that'd be really helpful too for having those going forward.
Yep.
And I just want to, were you going to say something, Greg?
I was going to say that the whole meeting has been recorded, and so that this will be posted on the Raise website, but we can definitely pull together some notes for you guys as the council members, because you're right, there's a ton of great stuff that just happened in this past hour, and we've got to try to capture it.
And don't want us to reinvent the wheel. And I just wanted to triple back up what everybody's been saying about the caregiver situation. Like, it's affected me directly as a person living with a disability. Like, I've had to go back to living with my parents after living in my own apartment for years, and it's just, you know, it's the reality. And I tried living on my own and ended up getting a bed sore and had to wait like five hours every now and then to get turned because I didn't have the care I needed. And, you know, I'm not saying this to, like, you know, go out, play a violin for you, but yeah, it's real, and it's, you know, affecting one of your own directly. And I'm really happy that everybody's giving it attention and value.
Great. Thank you, James. Any other questions or comments from folks before we begin to close out here for the afternoon?
Fred, can I just say on the home care side, you know, Mike and I both used to work for Medicare home health, and he worked for National Association of Home Care Hospice, and I worked for a quality group that does home health. I think it's the combination. It's not just the payment issue, but there's also, you know, some other sort of structural stuff around how home care workers are employed that I think would be worth examining. I'm thinking of, for example, the change in overtime rules, which was intended to allow more protection for home care workers, but created this sort of unintended effect of folks getting their hours reduced and then having to work for several different agencies, and you know, especially in rural areas. So I think there's some regulatory stuff as you're thinking through those issues to maybe dig in on to understand what happened and how it might be restructured.
Sure. So what I'm hearing is that there's a lot of things that could directly impact the availability of a workforce, but then there's all of these things 2 or 3 layers removed that you don't think about the consequences, but yet they need to be considered. Yeah, absolutely.
Exactly.
Were you saying that what was getting cut specifically? Can you reiterate?
So yeah, a couple, I feel like time has no meaning after COVID, but you know, within the last 10 years, I'll say broadly, used to, if you're a home care worker, you were classified the same way that you might classify a babysitter, and you weren't eligible for overtime. But what that meant is that for some families, home care workers were working just a crazy number of hours. So advocates pushed to have that rule changed so that home care workers would be eligible for overtime payments. But then some businesses responded and said, well, we don't want to have to pay overtime or benefits and all this. And so our response is to cut your hours so you're no longer full-time. That means if you're a worker and you're trying to get to the full-time hours, you now would have to be employed by multiple different agencies. And that's really hard on people and families, because then your caregiver can only do 10 hours a week or whatever. And then if you need more help than that, you have to get additional caregivers. And you've got this sort of churn coming in and out of the home, which can be really complicated.
Yeah, and the other thing I always worry about too is if they did increase wages for caregivers, would that end up with states cutting hours given to the care recipients too? And that's always a caveat that I kind of have in the back of my mind too.
Thank you. All right, we are at 2 o'clock. I know that Jessica Schubel had to drop off. She had another meeting, but I do want to just extend ACL and the council's just extreme gratitude to Jessica for spending the hour with us and providing the administration perspective on this. It is so greatly appreciated. And to you, Grace, and Mike, thank you for just everything that NAC has done, you know, with NASHP in terms of, you know, the caregiver stories that we have that are such a key part of this report, and also just your general the support and collaboration throughout this whole process. Thank you so much. Allison, are you there?
I am here.
All right. I think you can go ahead and close us out.
Okay, great. Those were some really, really great and exciting presentations. And I think it gives a lot of food for thought for the council to think about. I mean, clearly the intersection between, as we heard really for so much of the last 30 minutes, between the paid direct care workforce and family caregivers, I think the initial report and recommendations already touch on those connections, but as we heard from everyone, this is an interconnected system, and that's why I think so many family caregivers are looking closely at many of the provisions that Jessica talked about in the Build Back Better plan, and that Grace and Mike talked about, that Congress is considering, because the more we are able to expand the formal supports, in some ways, it's the less that families have to take on to fill those gaps. So a really important conversation. And another clear theme that I really heard was making sure that caregivers have a voice in the service design, the services that are designed to help support them. Clearly, respite needs more input from the people for whom respite is targeted. I think that was a clear piece. And then finally, just the important opportunities that are facing us right now. I've said to Greg so many times as we're starting to think about the National Caregiver Strategy, it's both intimidating and exciting that the landscape is kind of literally changing beneath our feet as we're working to support you on putting this together. But it is really, really an exciting time. So let me just turn back to close out the meeting with a few thoughts. Again, thank you to everyone who contributed to the presentations and to the report. It's really been incredible. And when the council's initial report to Congress is released tomorrow, it will really mark an important step in moving forward on our agenda to support caregivers. We will celebrate the report and the impact we are already having on the national conversation about family caregiving. And then once everyone gives themselves a pat on the back, maybe a toast, we're going to roll up our sleeves and immediately begin working on next steps. I do want to take a moment before we start thinking about the hard work ahead of us to just recognize how far this group has come in such a short period of time. Less than a year ago, in November 2020, after a lot of work, the Council adopted 26 recommendations to improve and better coordinate federal, state, tribal, and community programs and activities to recognize and support family caregivers. And now, only 10 months later, and it was 10 months while each of you were balancing your own caregiving and other responsibilities throughout the pandemic, the Council has completed this initial report to Congress. It's really amazing. Next, we're going to work together to develop the National Family Caregiving Strategy. And as this strategy is developed, I am hopeful that it will coincide with our nation's recovery from the COVID-19 pandemic. But even with recovery, many caregivers will be dealing with the impact of COVID for a very long time. And as we discussed earlier this afternoon, COVID only exacerbated and shone a light on many issues that caregivers faced before the pandemic, and that we know will continue after the pandemic unless we succeed in seizing this moment to make changes. All of this comes together to really make the need for us to work together in developing this National Family Caregiving Strategy and getting it to Congress all the more urgent. And ACL is here to work with and support the Council as it moves forward. The strategy will, of course, recognize the hard work caregivers do so that others can live meaningful lives with dignity and independence, and identify ways to make caregiving more effective and sustainable. I really urge the Council to give special focus in developing the National Caregiver Strategy in identifying and addressing inequities that we see in communities across the nation. I think the initial report did such a great job looking at and sharing the stories of caregivers who come from all types of communities and who may be underserved. And we really need to make sure this strategy addresses the sad reality that so many caregivers of color and caregivers in underserved communities have been neglected for far too long and have additional barriers in accessing the services and supports that they need. So let me just end by saying thank you so much for the work you have already done. Thank you in advance for the work that you are about to embark upon. And really, thank you to this council for everything that you're doing. To all the caregivers who are listening in today, thank you for your important and hard work. And tomorrow, when the initial report to Congress is released, please consider it a day of recognition. It's well-deserved, and thank all of you for your incredible work. I'll turn it back to you, Greg, to close it out.
Great. Thank you so much, Allison, for your support throughout all of this. It's truly inspirational and just such a tremendous value to the work that we do. So be on the lookout tomorrow in the morning Eastern time for an announcement from the Administration for Community Living. We will be delivering the report to Congress in the morning tomorrow. Once that happens, then we will send out a press release and an announcement, and we have a revamped new web page that will go up that will house the report and a lot of different supporting materials that go with it, including some social media graphics and messages that folks can feel free to use. They will be available to the public to really promote the report's availability and release. Following tomorrow, get ready. You will be hearing from me as we begin to look ahead in the coming weeks to convening our federal partners to begin working on the federal component of the strategy. And very, very close thereafter, this fall, we will also begin turning our attention to the other sectors that the caregiving strategy is meant to address: states, communities, healthcare, philanthropy, employers, you name it. So we are going to begin to get to work on that in very, very short order. Once the dust settles a little bit after tomorrow's release, it should be an exciting day. So with that, we will go ahead and adjourn the meeting with ACL's heartfelt thanks to you, and I'll be in touch. Thank you all.